Hi, I'm Jessie Gruman, President of the Center for Advancing Health. Have you ever used the Blue Book to help you make a decision about selling your car? Have you ever used Consumer Reports to help you figure out which refrigerator you want to buy? You know, I don't think twice about using this kind of resource to help me make a good decision. I know what I don't know, and that my options have different prices and qualities. And I know there's good objective information out there that will allow me to make a good, quick decision. I also know that I'm not alone, both in my lack of knowledge and my need for it. Millions of us use such tools to help us make decisions ranging from vacuum cleaners to vacations. And so it's interesting that so few of us turn to similar tools to help us make decisions about our health care. After all, most of us don't know that much about health care, and we'd be hard-pressed to weigh all the pros and cons of the various hospitals in our community, for example. And there are such a lot of tools around. Both public and private sector groups have developed tools to help people make informed decisions about health plans and hospitals and long-term care facilities and doctors and medical treatments. Yet, in a recent Kaiser Family Foundation survey, only 14% of adults indicated that they'd seen and used comparative health quality information in the past year. So what gives? Why do so many of us abandon the familiar role of the savvy consumer when making decisions about our health care, instead, choosing the health plan with the nicest ads or the hospital recommended by the woman behind us online at the checkout at 7-Eleven? This question is the basis of a research report called Getting Tools Used, issued in June by the Center for Advancing Health. The aim was to learn something from successful decision support tools outside of healthcare that could increase people's use of tools to make decisions within healthcare. So detailed case studies of 4 successful non-health related tools were developed: Consumer Reports Car Buying Guide, eBay, U.S. News and World Report America's Best Colleges, and the FDA's federally mandated Nutrition Facts Panel. 5 experts in health-related decision aids commented on the keys to their success and the implications for tools relevant to choices in healthcare. The findings were clear. The successful tools have in common that they come from a trustworthy objective source, their content is tailored to the interests of the user, each tool is targeted to the user's capabilities, and all of them are highly visible and readily available nationwide. What this means about what sponsors of healthcare decision aids can do to increase the use of their products can be found on the center's website. But here's what's really important. The public's indifference to health-related decision aids is not trivial. Healthcare has never been more complicated. Whether we're sick or well, we are now responsible for making more decisions about our care than ever before. And the stakes of our decisions have never been so high. There is simply no way we can make well-informed decisions without relying on objective information that's arrayed so that we can understand and weigh the trade-offs of our options. Increasingly, being able to find safe, decent health care depends on our ability to locate trustworthy tools when we need them and then to use them to help us make the choice that meets our needs and preferences. There is much work to be done.